In our next presentation, Dr. Ann Edwards will discuss the state of coverage, Medicaid, CHIP, and marketplaces. Dr. Edwards is co-lead of Children's Health Initiatives at Health Partners and chair of pediatrics at Park Nicollet Health Services. Having previously served on the AAP Division of Pediatrics 2020 Task Force and as chair of the AAP Committee on State Government Affairs, she now co-chairs the AAP Task Force on Pediatric Practice Change and serves as the AAP District 6 Vice Chair. Her area of interest include healthcare redesign, quality improvement, health disparities, early brain development, cultural effectiveness in healthcare, and child advocacy. Please welcome Dr. Ann Edwards.
Good morning. I am looking for my clicker. Well, anyway, I'm here to talk to you about the state of coverage, Medicaid, CHIP, and marketplaces. I assume that no one's heard any of those words in the media this week. Thank you. I have no disclosures. So actually, I stood here 3 years ago in this very place talking about the Affordable Care Act and really gave a presentation about what it was like to be a 3-year-old because the ACA was 3 years old at that time. Today we're going to look at where we've been and where we're going together. Now, thinking back, a 3-year-old, at that time, the ACA was growing and developing. It had only been around for 3 years, and the marketplaces had just started enrolling. The ACA was learning through exploring, and we were all beginning to think about what this could mean. And finally, it was becoming creative. Think about yourself as a 3-year-old. It was becoming adaptive, testing limits, and something certainly our state of coverage very much continues to do today. And now, the ACA is 6. We are no longer talking about the law itself, or at least not usually, but really the paradigm of coverage that the ACA helped create, and more importantly, what the future could become. Now, think of yourself as a 6-year-old, right? You've started school, and what were you doing? You were showing increased independence. And what we know is what started with the ACA is not ending, but really evolving. You were growing in confidence. We celebrate the ACA's milestones as we continue to learn what works and what might need to continue some tweaking. But like all 6-year-olds, it needs ongoing attention and support. And we were really starting to think about the future. Now, my future, I thought I was going to be a professional basketball player, at least at age 6. So hopefully the ACA is thinking beyond that. But the ACA was a restarting point for insurance coverage in our nation. And just like our children, we now see ongoing opportunities to support the optimal development of access, benefits, and coverage for all children. Now, as we know, taking a patient history is really important in taking care of a patient and family. The Affordable Care Act was a major step, but also one in a long line of evolving healthcare within the United States. To name just a few, in 1798, the Act for the Relief of Sick and Disabled Seamen was enacted by the 5th U.S. Congress. The law actually authorized the creation of a government-operated marine hospital, but also mandated that 20 cents be deducted from the wages of employed sailors to purchase this healthcare insurance. In 1871 was really the precursor to the Surgeon General, which started for that marine hospital service. You'll notice that it wasn't until 1965, 51 years ago, that Medicare and Medicaid was created as part of the Social Security's amendments of 1965. And finally, in 1997, the Children's Health Insurance Program was created, now nearly 20 years old. So you can see we've had this evolving course of healthcare through the beginning of time. The former US Supreme Court Chief Justice, Louis Brandeis, once said, "The states are our laboratories of democracy." The same can be said of healthcare reform. It is really within the states that things are happening and that all these opportunities exist. About 20 years ago, in the 90s, several states, including mine and several pediatricians, thought about what they could do to expand state-level coverage for children above the federal Medicaid income threshold. This became the precursor to CHIP, which is eventually expanded across the country. The very nature of the federal-state partnership makes it ripe for experimentation, which means it's really important that we're all involved in every single state effort. So where are we today? Well, we have to take a step back and say, why was the ACA enacted? Before 2010, we had 48.6 million adults without health care insurance. That was just over 16% of the population. Now, the rate of uninsured children was better, at only 8.5%. But this was largely because of the great work of CHIP and Medicaid. What else? We've heard from Dr. Perrin that, yes, healthcare costs were escalating at an alarming rate. In fact, it was predicted by 2020 that the GDP for healthcare would be 20% of the GDP. And despite all that spending, when the World Health Organization looked at our healthcare system, it was ranked 37th best in the world. Something clearly wasn't working, and something really needed to be done. So what did the ACA attempt to set out to do? First of all, it set out to expand Medicaid for non-elderly adults to 138% of the federal poverty line. We later know that the US Supreme Court made this optional. It created marketplaces for people who did not have insurance to be able to gain it. It also offered federal subsidies to help make this coverage more affordable. It ended the practice of denying coverage for people with pre-existing health conditions. Plans must actually now spend 80 to 85% of their premiums on actual health care delivery. Bright Futures was specifically named and must be paid with no copay for families. It allowed young adults to stay on their parents' insurance until age 26. It capped out-of-pocket costs for families and individuals and put an end to the lifetime dollar limits on coverage. This made a huge difference for children with complex and really costly health conditions. It assured that families could choose a pediatrician as their primary care physician. This was really the transformative healthcare insurance delivery, the largest since the creation of Medicare and Medicaid. So what does coverage look like today? You'll see. There's opportunity for coverage from below the poverty line and throughout, depending on where you can access them. And what has it really done? It's set out to do all the things I just mentioned, but how well have we done? First and foremost, the ACA has led to historic widespread gains in insurance coverage across the country. The rate of uninsurance in the United States has now plummeted to an all-time low. It is now at 8.6%, with over 20 million Americans gaining coverage. This is the population of the entire state of New York, or put another way, the population of the entire number of states with the first letter A. Today, the rate of uninsured children stands at a low of 5%. Now, certainly we have work to do, but we cannot deny that the Affordable Care Act has offered coverage and access to care for millions of children and adults. How else has the ACA succeeded? Millions of children are receiving Bright Futures without copays, and Bright Futures is now written by name in federal law as the gold standard of pediatric preventive care. The ACA consumer protections are ensuring that people are not kicked off coverage when they need it most. More and more young adults, as they transition out of school, are able to maintain their health care coverage on their parents' insurance. And where Medicaid expansion has occurred, we truly see this having a benefit. We know that healthy parents lead to healthy children. And while we can talk about whether or not the Affordable Care Act has truly controlled costs, it has slowed spending. The National Health Expenditures estimates that the rate of rise is now at 5.8% as compared to 8% in decades past. And we know it's spurring innovation. As we see the chaos in the fields and as people bring it to the forefront of the dialogue, we see states and on the federal level looking for new opportunities, from Medicare's accountable care organizations to numerous state-level Medicaid innovations. We are really looking to transform healthcare to finally promote health. So what about the marketplaces? As of February of 2016, 12.7 million Americans had enrolled or re-enrolled in the marketplace plans. Now, how many of these were children? Just over 1 million. In contrast, there are 45 million children on Medicaid and CHIP throughout the country. Now, it is important to note that the marketplace coverage was intended to address the problem of uninsured adult coverage in the United States. So therefore, what we note is that the actual plans on these marketplaces differ and prefer coverage for these adults. So the Academy has been focusing on 3 key areas. First of all, benefits. In contrast to Medicaid and CHIP, most plans sold in marketplaces don't have benefits designed for children. Essential health benefits are required in over 10 categories. However, we know they are not as robust for Medicaid as Medicaid or CHIP can provide. Second, cost. Certainly, ACA has important lifetime and annual dollar limits and provides tax subsidies in the marketplaces to help make these plans affordable. However, many plans are just not affordable with the substantial deductibles and high out-of-pocket limits. Finally, as purchasers and payers continue to look for ways to control costs, we are starting to see something called narrow networks, where only certain providers can be accessed by families on these plans. They are marketed as less expensive plans, but they truly have created some significant barriers to specialized care for children. And we have seen this phenomenon now translate to the employer-based insurance. We know that states will be debating the issue of network adequacy in the upcoming session. We will need everyone on board to assure that children have the appropriate access to care and coverage. Now, with all these issues of marketplaces, we need to really look at the importance of CHIP, the Children's Health Insurance Program. Now, as I've previously alluded to, this was a substantial change in benefits and decreased the uninsured rate for children. It's a wildly successful program, ensuring that families living above Medicaid coverage who can't yet afford insurance have access. Today, there are 8.4 million children enrolled in CHIP. And we are happy to say that every state in the nation has a CHIP program designed specifically to meet the unique needs of children. And in a rare gridlocked environment on Capitol Hill, CHIP is a rare bipartisan success story. In 2015, MACRA extended funding for CHIP until 2017. So therefore, one of the first areas of focus for advocacy in the new Congress will be to extend CHIP funding. We need long-term funding for CHIP so that states can plan for a future with a CHIP program, and so that families have the security of knowing child-focused coverage is available and affordable while we fix the glitches in the marketplace. Where does Medicaid fit in all of this? Medicaid is the single largest insurer of children in the United States. It provides virtually no-cost comprehensive health insurance coverage to children with an early and periodic screening, diagnosis, and treatment, which guarantees that every child gets the services they need. Medicaid is critically important to the healthcare needs of families, is the foundation of CHIP, and ensures that even when families have financial setbacks, they won't lose coverage for their children. Now, with the Affordable Care Act, Medicaid is no longer solely or largely a children's program. Currently, 31 states and the District of Columbia have adopted the ACA option to expand their programs to provide much-needed coverage for adults who care for the children. And while such coverage does not directly impact children, it is important to our entire communities. And so therefore, it is vital that our pediatricians advocate on behalf of all families. We know that many chapters have taken on this fight and will continue to do so. Payment. Yes, the first 2 years there was a payment bump to Medicare parity in 2013 and 2014. This has gone away. 16 states continue to provide this Medicaid parity. It is an area of prime focus for the Academy to continue to advocate for the continuation of this and appropriate payment so that we can provide the services for children and families that they so deserve. It would also not be appropriate to discuss Medicaid today without discussing system transformation. Again, states are the laboratories of change, and we know that dialogue is happening. A lot of it involves the adult world. However, if we are not at the table, children will be left behind, and we need every single person to prioritize this. The paradigms being discussed are many. They could have differing impacts on children, but certainly the opportunities are many more. So what does this really mean for the future? Well, if you haven't heard, there's an election, 14 days. And it is vitally important to the future of our country. And while the presidential campaign has gotten a lot of the focus, I want to remind people that actually 80% of the 8,000 legislative seats in states are up for re-election. It is so very important that every single person votes. And when you vote, please keep kids in mind. By now, I hope you've heard about the Blueprint for Children that the Academy put out, because we need to hit the ground running. When we have the new Congress, when we have a new president, when we have our new state legislatures, this is a key resource for all of us, which outlines the opportunities, but also the optimal care for each agency that we can provide in the future. On a state level, again, we all need to be at the table. These dialogues are happening each and every day, and if pediatricians are not present, children will be forgotten. So once everything settles, once the future goes forward, we have to continue to think about the evolving healthcare world. The Affordable Care Act is age 6. Soon it will be a tween, and eventually an adolescent. We know how unpredictable adolescents can be. They really need our attention. So it is incumbent on us to be present. And by us, I mean we. And by we, I mean you. Lend a voice, lend lend a vote, be present, truly be the person you needed when you were an adolescent. Thank you.